more and more people come asking to how they can solve the problem of their hair falling out. And well, also, as you age, your hair starts to thin out and fall out. So here we're gonna talk on options on how to resolve this situation. Hi, I am Dr. Lina, Triana, and I'm here to help you go through the reasons why your hair fall out and how to solve it. Many times we don't understand why the hair starts to fall, and we just go to the store and buy whatever we find, right? And many times we don't like the oily hair. So one of the main reasons why we start losing hair is genetics. Why genetics? Genetics has two components. Number one is because we are born with a higher number of certain kind of receptors. And number two is because we have more of a bad hormone. I call it bad. And it's called the dihydrotestosterone hormone. Dihydrotestosterone is the cousin of testosterone, and testosterone is a sexual hormone. I will talk a little bit more about that in a little bit. So if we have a large number of receptors of dihydrotestosterone in our scalp, and as we age, the proportion of testosterone changes, goes down, and the dihydrotestosterone goes up, the bad hormone, as I say. So as soon as we have more dihydrotestosterone in our blood, it will join to the receptor that should not be in our scalp and start affecting the root of our hair. And it makes them, every time that the hair is thinner and thinner and thinner, until it just one day decides not to grow anymore. Another reason why the hair can start to fall is because first, I don't eat right, of course, and two, I'm using the incorrect treatments or using the incorrect shampoos and different lifestyles that do not help me in preventing the falling out of my hairs. For example, for having a healthy hair, I need to reach out in my scalp and see if it's a greasy scalp. Many times we have greasy scalps, but with thin hair. And since we don't like grease in our hair, we use products that take away that grease. But that will make that hair more prone for breaking. And that will worsen my thin hair. It will make it more prone to break, and it will make them thinner. Other people can have a dry scalp. And many times the dry scalp is unnoticed, meaning that we keep on living and buying any shampoo that we find, but that scalp ends up being irritated. When you see the scalp of those people, you see a redness there. And that chronic inflammation will affect the root of my hair and make it more prone for falling. And no wonder why we start losing our hair and feeling that we have alopecia or that we are bald. So living a healthy lifestyle is basic for every little part of our body. And our hair is no different. That's why it's so important that we do not automedicate ourselves. Yes, we automedicate ourselves for having a healthy hair, and that's not right. That's why we should seek someone that has the knowledge, training, and experience, and a specialist in hair that can really help us prevent that falling of our hairs. So, for example, if you get an appointment with us, and actually we can start with a virtual appointment, we can start recommending what will be the best options for preventing the falling of that hair. We're building up for your future. And if you come here live, we can also do some exams with special microscopes, precoscopes, that will really look on how the hair is growing. So starting with the non-surgical part, it's important that we take the correct supplements and nutrients that are on the right proportions so that we can really have good effects. Many times we go and buy, for example, biotin or vitamin E or whatever they tell us that will improve our hair, and we just take all of those pills. And we see no change. Why? Because they have to be a combination of different nutrients in the exact percentages so that we can have good results. And many times when we don't do that, they just will go out of the urine and just give us a stomach ache and will not work. That's why we have developed a supplement with the right percentage of nutrients so that it can help you in preventing the falling out of the hairs. Another thing you can do is choose the right products for cleaning and hydrating your hair. For example, we also have a variety of cleaners for the hair and also balsams and some specialized hydrating creams depending on the type of hair you have. Remember, sometimes we have thin hairs with oily scalps and we try to take away the oil, and what ends up happening is a hair that is breakable, and it's not good. So again, always choose someone that can advise you on what is the best option for preventing the hair falling and also promoting a healthy scalp and a healthy skin. When patients come and has irritation on the scalp, we can move a little forward and recommend them plasma. Plasma will help with that irritation. And for those that come that are really having trouble with too much irritation, even desquamation and even bleeding of the area, we can also recommend exosomes. So it's like a ladder of treatment. Every patient is different. Also, when we have really thin hair, we can promote other machines. For example, we have electroporation, where we put some substances that will help that hair grow stronger and thicker. We also have the laser, a diode laser that also helps clean the pore so that the hair are better nurtured, and that way we will enhance that hair growth. Another thing that we can have is ozonotherapy that will also promote hair growth. Remember that the hair has some stages of growth. The first stage is that the root is alive, but it's just there waiting. Then the root starts to work to grow the hair, growing, and then there's another phase where it doesn't grow much, just stay there. And then the fourth phase is when the hair is falling out. We need to examine in what moment of the life cycle of the hair that scalp is. That's why we use the trichoscope, and then we recommend what type of treatment will be the best for that patient in that moment. If we go on the scale of treatment, we are going from something that is drinkable to something that we put on top of the scalp. So we go from the less invasive to the more invasive. Some pills, lotions, creams, and then technology. And do you remember when we spoke about the bad hormone, that dihydrotestosterone? Well, we need to bring it down. And that's why we recommend that you take finasteride 1 milligram every day. That will bring down the levels of dihydrotestosterone, so less hormone will join to the receptors in your scalp, and that way we will prevent the hair to get thin, and finally don't grow anymore. Remember, it's important to have 1 milligram because that dihydrotestosterone also works in getting big the prostate. So patients that have a big prostate will also take the finasteride, but 3 milligrams. So make sure and go to the specialist and take the right dose. Also, dihydrotestosterone gives those funny hairs that we don't like on the nose or on the ears. So again, that's why I call it the bad hormone. The dihydrotestosterone, the bad hormone, remember that I said it's a cousin of the testosterone. So since the testosterone is going down and we're giving finasteride to bring it down again, both are sexual hormones. If we lower the sexual hormones, we can have a decrease in sexual arousement. It's important that if that happens, we stop the medication. But don't worry, because only 3 to 5% of patients will experience it. And if it does happen, it doesn't damage anything. The only thing you have to do is suspend the medication and your function will come back. So in the evaluation, we can see if the patient has the possibility of regrowing the hairs, or definitely the root is dead. Once the root is dead, the only option that we have is to put new hairs where those hairs will not grow anymore. And that is done through a hair transplant. Hair transplants are not only for the scalp, they can also be done on the eyebrows or on the beard, and also for defining a front line of the hair. What do we do in a hair transplant? In hair transplant, we will take out the hairs from the back part of the scalp and put it wherever you and me decide that is the area that you want to have more density of hairs. We use a FUE technique, and we use a robot that will help us take out the follicles, so that way there's less trauma and less bleeding, and a more effective result. Important that since we do the FUE technique, you will have no scars. There are really miniature punctures where we get each follicle one at a time, and we relocate it in the areas where we are going to give more density. The procedure is a pretty simple procedure done under local anesthesia, but we are all about patient safety. That's why we only do the procedure in the operating room and with an anesthesiologist that is only for that patient through the whole time. The procedure lasts between 5 to 7 hours. And again, it's done under local anesthesia with a team of specialists that we have been building up for more than 30 years. Being Lina Triana, the leading surgeon. After the procedure, next day, you will come back to the clinic where we will wash your hair. And important that you wash your hair with abundant water throughout more or less 10 to 15 days. You will have some scabs in the area where we put the new hairs. In the back part of your scalp, you will have some miniature scabs that will fall between day 3 to day 5. And again, the scalps where we put the hair will fall between day 10 to day 15. Many patients that come abroad to Colombia to have the procedure done leave 3 days after the procedure. As you see, it's a minimal invasive procedure that will give you, again, hair in those areas that you are feeling not good about. The final result is not immediate. You will see it more or less after 8 months to 1 year. Remember that each hair has a growing hair cycle. And that's why I never promise that you will get out of the procedure with a lot of hair. No, you'll have to wait until that hair regrows, and it will take more or less 8 to 10 or 12 months. Many people are afraid that they will look just unnatural after a hair transplant. And the important thing is you go to someone that has the knowledge, training, and experience. We have more than 20 years doing the procedure with a team of specialists that will focus on the best option treatment for you. Also, another thing that is very common when you go to those places that don't have the experience is that the donor area can start to look bald. That will not happen with us. We really take good care of you, so the procedure has the best results. We also have some special products for maintaining a healthy beard to enhance the growing of your eyebrows, and very important, one specifically for your eyelashes. If you are really worried about the falling out of your hair, go ahead and contact us. We can really help you. www.drlinatriana.com. Ask for a virtual appointment. And of course, join us in our social media and subscribe to our YouTube channel.